Today we're going to talk about a common condition that affects millions of people worldwide, peripheral artery disease, or PAD for short, and how dietary changes, especially adopting a Mediterranean diet and reducing refined carbohydrates, can play a crucial role in managing it. Whether you've been recently diagnosed with PAD or you're trying to support someone who has, this video is designed to help you understand the condition, the role that diet plays in blood vessel health, and the specific benefits of shifting toward healthier eating patterns. Peripheral artery disease is a condition that occurs when the arteries that supply blood to your limbs, especially your legs, become narrowed or blocked due to a buildup of fatty deposits, also known as atherosclerosis. As these arteries narrow, blood flow becomes restricted, leading to symptoms like leg pain when walking, cramping, numbness, or in severe cases, wounds that don't heal well. PAD is more than just a problem with the legs. It's a red flag for widespread blood vessel disease and increases the risk of heart attacks and strokes. That's why managing PAD is so important, not just to improve walking ability, but to protect your overall health. One of the most powerful tools we have to manage PAD, alongside medications and exercise, is diet. Specifically, a Mediterranean-style diet that minimizes refined carbohydrates. When we talk about a diet and PAD, we're really talking about how food choices affect the health of your arteries. Diets that are high in saturated fats, added sugars, and refined carbohydrates can contribute to inflammation, poor blood sugar control, and the progression of atherosclerosis. These dietary patterns damage the endothelium, the inner lining of blood vessels, making it easier for plaque to build up. On the other hand, healthy dietary patterns can reduce inflammation, improve cholesterol levels, lower blood pressure, and enhance circulation. All of these effects are especially important for people with PAD, where blood flow is already compromised. Now let's talk about the Mediterranean diet, what it is, why it helps, and how you can get started. The Mediterranean diet is inspired by the traditional eating habits of people living in countries bordering the Mediterranean Sea, like Italy, Greece, and Spain. It focuses on whole, unprocessed foods and emphasizes plant-based ingredients, healthy fats, and lean sources of protein. This way of eating has been extensively studied and is consistently associated with a lower risk of cardiovascular disease. But what's particularly exciting is how the Mediterranean diet can directly benefit people with PAD. Several studies have shown that patients with PAD who adopt a Mediterranean diet experience improved walking distances, better cholesterol levels, and fewer cardiovascular complications. The diet supports artery health, helps control blood sugar, and promotes overall better circulation. At the center of the Mediterranean diet are fresh vegetables, fruits, whole grains like farro and barley, legumes like lentils and chickpeas, nuts, seeds, and healthy fats, especially extra virgin olive oil. Fish is encouraged at least twice a week, and poultry and dairy are included in moderation. Red meat and processed meats are limited. Herbs and spices are used generously, and meals are usually built around plants rather than animal products. But just as important as what's included is what's reduced, especially refined carbohydrates. Refined carbohydrates are foods that have been stripped of their natural fiber, vitamins, and minerals. Think white bread, pastries, sugary cereals, white rice, pasta made from white flour, and of course, sugary drinks. When you eat these foods, your body quickly breaks them down into glucose, causing spikes in blood sugar and insulin. Over time, this can worsen insulin resistance, promote inflammation, and contribute to the development and progression of atherosclerosis. In people with PAD, especially those who also have diabetes or prediabetes, these blood sugar spikes can further damage already compromised blood vessels, reduce circulation, and increase the risk of serious complications like ulcers or even amputations. What's more, refined carbohydrates often take the place of more nutritious foods in the diet, displacing fiber, healthy fats, and essential nutrients that your body needs to maintain vascular health. Reducing refined carbs has several specific benefits for people with peripheral artery disease. First, it improves blood sugar control. Stable blood sugar reduces damage to the blood vessels and slows the progression of atherosclerosis. Second, it lowers triglycerides, a type of fat in the blood that, when elevated, contributes to plaque formation. Third, by cutting back on sugar and refined grains, people often reduce their calorie intake and lose weight. Even modest weight loss can improve mobility, reduce pressure on the legs, and improve walking distance in people with PAD. Finally, reducing refined carbohydrates may enhance the function of the endothelium, the thin layer of cells lining the blood vessels. making it easier for blood to flow and for the body to respond to physical activity like walking or exercise therapy. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, let's talk about how you can reduce refined carbs and shift towards a Mediterranean diet. Start by swapping white bread, pasta, and rice for whole grain alternatives like whole wheat bread, quinoa, brown rice, or farro. These grains provide more fiber and have a gentler effect on your blood sugar. Next, increase your intake of vegetables, especially leafy greens, cruciferous vegetables like broccoli and cauliflower, and colorful fruits and vegetables like bell peppers, tomatoes, and eggplant. Try to include vegetables at every meal, not just dinner. Use extra virgin olive oil as your primary cooking fat. It's rich in monounsaturated fats and antioxidants that support heart and vessel health. Snack on a handful of nuts instead of chips or crackers. Almonds, walnuts, and pistachios are great options and are rich in nutrients that reduce inflammation. Eat more legumes like lentils, black beans, and chickpeas. These are not only excellent sources of fiber and plant-based protein, but also help stabilize blood sugar. When it comes to protein, favor fish, especially fatty fish like salmon, sardines, and mackerel. These are rich in omega-3 fatty acids, which help reduce inflammation and improve blood flow. If you eat dairy, choose plain yogurt or cheese in moderation. And when you consume poultry or meat, aim for small portions and avoid processed meats like bacon or sausages. Limit or eliminate sugary drinks and try to prepare meals at home whenever possible. That way you can control the ingredients and avoid hidden sugars and refined carbs. Changing your diet isn't easy, especially if you're used to high-carb convenience foods or processed meals. But the good news is that even small changes can make a difference. Start by making 1 or 2 changes at a time. For example, begin with breakfast. Swap sugary cereals for steel-cut oats with fruit and nuts. Or replace white rice at dinner with a side of roasted vegetables and lentils. You don't have to be perfect. The Mediterranean diet isn't a strict plan. It's a flexible, enjoyable way of eating that you can adapt to your tastes and lifestyle. If you need support, consider speaking with a registered dietitian who can help tailor the plan to your individual needs, especially if you also have diabetes or kidney disease. Before we wrap up, it's important to remember that while diet is powerful, it works best when combined with other lifestyle measures, especially exercise. Supervised walking programs have been shown to improve symptoms in people with PAD, especially those experiencing leg pain or cramping when walking. When combined with a healthy, artery-friendly diet like the Mediterranean pattern, exercise can further improve blood flow and reduce the risk of complications. If you or someone you love is living with peripheral artery disease, the message today is hopeful. By adopting a Mediterranean-style diet and cutting down on refined carbohydrates, you can take meaningful steps to improve your circulation, reduce symptoms, and protect your heart. These aren't extreme or restrictive changes. In fact, they're about embracing delicious, colorful, nourishing foods that support your long-term health and quality of life. Thank you for watching. As always, take care of yourself and make the most of your day.